so that we have more time for questions, for answers. Tommy is an expert in this field many, many years. For 30 years now, we have our center in Haifa, Israel. Hundreds of people come, many people come from outside of Israel to Tommy for doing with our LifePower processes. We have more people here who are experts in this area. We have in Haifa a big team, about 10 people working together in academy. We have an academy where people can learn this, and also counselors, or we call it listeners, somebody who listens, somebody to work with. But really, we would like to answer your questions and open it up. Any idea, anything you would like to ask, please. Yes, Dani.
So you talked earlier about the spirit, that the man is a spirit, and I can really relate to that. But I also wonder, because you started saying also about like doctors who are like, saying that is something from the brain, and I'm just wondering, does this mean that when you have something, I don't know, like a disease or something hurts, like, can you explain on that more?
Wow, okay, so now, because of Dani, we stay here 4 more hours. Okay. Big question. Okay. Well, most illnesses that we have are what is called psychosomatic. Okay, now psychosomatic is not a new word, it's a Greek word. Psych is the spirit or the soul, so the person himself, psych, like psychology is study of the spirit. Okay, that was the original word, psychology, study of the spirit. So psychosomatic, soma in Greek is the body. So psychosomatic is a mental condition influencing the body. Now we know that many illnesses are due to stress, due to trauma, okay? Due to all kinds of mental or spiritual situations that affect the body. Now, of course, when you have an illness, you go to the doctor, you go to the hospital, and they are very good technicians at handling the body. But if the illness or the condition that you suffer from is also mental or spiritual, you have to handle the spirit, or the person himself, or the mental cause that brings about the illness. Now, so this subject is covered in chapter 3 of the book. Chapter 3 covers the spirit. Now, we spoke about pictures in the mind, and you think of a cat and you see a cat, okay? So that's easy, because when you sit here comfortably and you recall the evening, like tomorrow morning, a friend will ask you, where were you yesterday afternoon? You say, oh, I went to the Kafka Cafe and they gave some food, and there was this guy and he was talking about some stuff. It was okay, it was quite interesting. So this we call a pleasure moment, so you can easily remember and use the memories of this meeting, okay? But if you want to go outside the room, and we don't let you go outside, or if I chain you to the chair, or if I inflict some force on a person, you have a situation that you do not want, that you do not like. Okay, like maybe Luke and Thomas, they want to talk, and I say stop talking, I say, okay, so it becomes, from a pleasure moment, it becomes to a suffering. Like, I want to cross the street, but as I cross the street, a driver in the car, he wants to go this way, and boom, he hits me. Well, we call it an accident, okay? And I don't like this accident because I wanted to cross the street, but the car was going the other way. So I have force, unintended force, put upon me. And these moments of force and pressure or something bad happening to me, they become a trauma. And the traumas, the traumata, that we accumulate in our life, they become bad memory, okay? And the bad memory continues to affect me in a bad way. Like it causes me situations that I do not want. Okay, Dana? So these bad situations, the bad traumas, when they are reactivated, because something is causing the trauma to come back. Maybe when you were in school and you had a very bad teacher who gave you a hard time, shouted at you, or was abusive to you. And I went to school in England as a kid, and at school in England they gave you 6 of the best. What is the best? The teacher had a cane, and when you misbehaved, you got 6 of the best. 3 of the best, 6 of the best, die beste. Yeah, apropos. Yeah, this was schooling in England. Now maybe, excuse me? Yeah, auf die Hand, yeah, with the ruler. Okay, so you got beaten up by the teacher, and this was when you were a small kid, and now you have traumata, and yet you come to Kaf Kaf Cafe, and this guy is talking, and you say, wow, he looks a lot like my teacher at school. He was also small, always with a white shirt, and always talking like this or like that. And this memory, this bad memory from the trauma from childhood comes back. And we call it Reaktivierung von einem Trauma. Okay? And this makes you feel not good. So these things that come up make us feel bad, and make us feel sick, and give us a lot of difficulty in life. And this is exactly what we do in LifePower. Tammy is an expert. Joseph, I'm sorry, entschuldigen Sie. Yeah.
I will be a little bit of a skepsis, because the bad...
Skeptic?
Yes.
Very good.
Because with the bad traumas, there is a medical condition, and we have a medical word for it. It's post-traumatic stress syndrome, PTSD. And also, not everybody thinks in pictures. You talk a lot of thinking in pictures, but there are people who think in language or numbers, and they are not. It's not a small amount of people. So I myself can't relate to thinking in pictures because I don't.
Okay.
I think in numbers,
Okay.
and I don't understand thinking in pictures because I can't relate.
Okay.
But also the post-traumatic stress syndrome. So you try to apply a philosophy to handle traumatic life experience for everybody to get them out of those situations stronger or live their life independent from those memories.
Yeah.
Okay, that's everything I want.
Okay. So the example with the cat was just an example because this is easy to do here. But you're right, different people think in different ways, and it's okay. It doesn't have to be limited to thinking in pictures. We have concepts, we have ideas, we have colors, we have feelings, we have a lot of things. The contents of our mind is very broad. Okay, the sound, of course, many things in our mind that we store. So post-traumatic syndrome, stress syndrome, whatever, okay, good. This is exactly what I call Reaktivierung.
Yes, of course.
So it's the exact same concept in different words, in different senses. My easiest answer to you is that LifePower is something that anybody can very easily experience. Because we can talk for hours about abstract concepts or philosophical, and of course a medical doctor or a psychiatrist who would come and discuss with me, he would try to prove that I'm wrong, and I would try to prove, no, I'm right, you are wrong. You know, and this can go on and on for ages, forever. So My best reply to you is an invitation to anyone here, Joseph, Pedra, Norma, many people here who can work with you with this technique, and you try, I don't know, just 10 hours, just a few meetings, and you see what it does for you. You see? You can try. You don't have to. You have a right not to do this. So nothing is enforced, because if I try to force something on you, that's a new trauma. Anything that is forced is a new trauma. So the one thing that we definitely are opposed to is, of course, taking people to a psychiatric hospital by force, because it causes them damage. Tying them up is bad. We think, and we have some evidence, that drugs are bad for the person, because our goal is to raise awareness and to put you more in control of your mind, and drugs or alcohol makes you dizzy. So no alcohol on the table. And when somebody comes to us for processes of LifePower, we say, please, no drugs, no medicine, keep your mind clean, so we can work with you. We have a very good friend in Israel. His name is Samuel. And the last time we had a war in Israel, in Gaza, 2014. And Samuel, unser guter Freund, his son was killed in the war. He was officer, he was fighting in Gaza, and our friend Samuel, all his life, suffered from headache. After 2-3 weeks, his son was killed. He went back to work because he had to go back to life. And many times, many days, when he drove back from work home, he got lost. He couldn't find his home. He was driving in the car, and then he says, where am I? And so throughout this time that he was driving, he was totally, we call it out of present time, not in present. He wasn't at all in the environment. He was somewhere else, and then he finds himself, he doesn't know where he is, and he has to find home again. So in Israel, when you have somebody in the family like this, the Israeli Army, Ministry of Defense, they have a lot of money, and they give you all the psychologists and all the treatments and all the medicines, everything you want, they will give it to you. And Samuel said, no, thank you. I don't want psychology, I don't want psychiatric drugs. But he remembered that he had friends. He's from south of Israel. He remembered that he had friends in North Israel with the LifePower Center. And he called me up and he said, Dani, you know what happened, because we were at the funeral, of course. I need your help. And he came to us just a few days, and we have a counselor, not even Tammy, our other guy, Aviv, and he was working with Aviv like a few days, maybe 10 hours, maybe less. And after this very short handling, we don't even use the word treatment, but this handling or treatment, he comes and he says, Dani, I don't believe it. Because the migraine headaches that I've had all my life, and after the accident, after my son was killed, it was all the time driving me crazy. Totally gone. And up until a week ago, when I started treating in Haifa, the treatment, I was crying all the time. I stopped crying. I can talk about my son without crying. I can find my way home. I don't get lost anymore. We have a lot of very good results working with people, because the technique that we work with is addressing the trauma that you have and is not trying to cover. When you take a drug or medicine to handle a mental condition, you're trying to put it away or cover it up or make it weaker. You handle the symptoms. You don't handle the basics. You're trying to do something with the symptom. So we say come awake, come in good mental shape, and when you really look at the source of the problem, you can make it vanish, you can make it go away. There is a datum that we work with. If a person has a problem, you know, people come to us and a person says, you know, I have this problem for a long time, and I know what my problem is. And I talk about my problem to my friends, I talk about my problem to my husband or to my wife, I talk about my problem to my psychologist. So I know what my problem is. So what is the one thing I know for sure? That of course the person does not know what his problem is, right? Because if he really knew what his problem was, he could make it vanish. So any situation or any problem that is lasting a long time is always because something you don't know. There is some missing element there. There's something about the problem that you do not know. So what we do in LifePower counseling is raising awareness, looking at it, and when you find out, I cannot tell you. So the LifePower counselor that never gives you advice, never tells you what it is. He never analyzes for you, because he doesn't know. What does he know? He doesn't know your life, he doesn't know what happened to you. But when you go to the root of the situation and you find the trauma at the bottom, then boom, you can make your problem vanish. Okay? Any other questions? Anything? Yes, Michael?
You said once you know the problem, it disappears, right? That's quite an easy equation. Can you elaborate on that? Why that really is?
The problem that you have stems from what we call it an unwanted situation, unwanted condition. There is something in my life that I know I don't want to have. Like, I'm angry at my husband or wife. I have fear when I need to do something. I'm nervous. I'm depressive. I'm sad. I'm tense. I have a situation that I don't like. Okay. And the situation that I don't like, I want to change, I want to get rid of. And I talk about it, I think about it, I'm sort of aware of it, but like I said, it's like an axiom that we have. If it's a lasting, unwanted situation, you don't know the source of it. Okay?
So the source is the situation.
The source brings about a situation. There is a trauma that is hidden. Now, what is the trauma? Now you're asking me to go into more detail, and I will have to do it. I promised I will answer all questions. A trauma has two things. A trauma has pain, and there are two types of schmerz. Physical schmerz, when I do this to you. So physical schmerz and emotionalische schmerz, like something bad happening. Okay, if I now get a phone call and they say, well, while you're having fun in Berlin, there is an accident in Haifa and somebody close is injured in the accident, killed in the accident, you know, something bad. So it's not physical schmerz, pain, it's emotional pain. Okay? Or you go home and you see flames and your house burning down. Or you go Monday to work and your boss says, sorry, Corona, raus. So something bad happening to you is an emotional trauma or physical pain. That's one thing about a trauma. The other thing about a trauma is lack of consciousness. Lack of consciousness. So when we go to the dentist and he wants to pull out a tooth, what does he do? Anesthetic. Right? He gives us eine Spritze to lower our sensitivity. because he's going to pull our tooth and it hurts. So our tolerance, our ability to tolerate pain is very low. Okay, when I do this, you say, ouch, that's not good. So we cannot stand pain. We try to get away from pain, physical or emotional. When pain is forced on us, we lose or we lower our awareness. And if it's very bad pain, boom, you faint. So our protection mechanism is to lower awareness or go unconscious. And this is stored as a trauma. It doesn't vanish. Okay? Yeah?
I understand his question like that he wants to know what is a dialectic process, what make it vanish.
Yeah. So the trauma has lack of awareness. That is why the psychologists call it the subconscious. And you don't know what it is. So Sigmund Freud, or I don't know who discovered the subconscious. He thought it was from childhood. Papa, mama, they say this. You love your mama loves your papa. You say, I love my mama loves you. So you have all these things in your subconscious. Okay? So what we do in LifePower counseling is gradually, slowly, we make it possible for you to see the contents, the traumas of the subconscious. So if anybody tries to tell you what your problem is, he doesn't know what he's talking about. So any kind of counseling, advising is useless, because somebody is telling you what is your problem. Hypnosis is bad, because there is somebody else trying to take control of your mind. If you're suffering and I give you a pill against depression, well, it's okay for a few hours, but the next day you're even more depressive. But if you can see the trauma that was hidden, if you can look at it, can see it, this is what we do. So we help you, we lead you to see the cause of this condition. And when you see this, wow, this is what it is, wow, okay. And so this conflict, we don't solve a problem, we help you see where the problem is coming from. And when you see the source of a problem, you can decide how to handle it, how to make it vanish. And the Dani will relate.
I have few words to say, really short, okay? Good. The reason why I came to Berlin with my husband, with his books, why I supported him while he's writing these books, and I really promoted it, is because in these books it's a summary of what I do in the last 40 years with lots of successes. Like my game in life, my purpose in life is to make people happy, like really, really happy. Like happy! And when they come and they do this processing, very fast they become really happy, productive, they have good relationship, they are able to study, they're able to handle their crazy mothers and crazy wives and be really successful. So this is my purpose. And the whole thing is that the technique that I'm using is very simple. You don't have to go to university for 7 years. I went to university and I studied, blah, 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 blah. Good, okay, but universities are good. But in order to really help other people, you don't need all that. You just read a book, you do it, and you go and help others. And my intention is that, some people here will take the book and says, wow, I want to help other people. Forget about helping your traumas. Forget about it. It's helping others, this is the thing, okay? And so I really would like, if anybody really wants to learn how to do it, either I come to Berlin, or you come to Israel, or you get help from Joseph, from Pedram, from Norman, from Rita, okay, from Ilya, and learn how to do it. It's very fast, okay, instant, no time. Things are everything goes too fast in this planet, okay? So that's my message, okay? Thank you for coming, thank you for listening, yeah. Thank you, Klaus. Thank you, Linda.
Thank you, Dani. So when you are fully aware, and this is the goal of what we do with LifePower, when you are fully aware of yourself as a spiritual entity, you're not your body, you're not your mind, you're not your emotions. Emotions, memories, property, body is something that you have. Okay? So it's not me, it's mine. Okay, I own a car, I own a nice house in Israel, I even own a shirt. I'm not a shirt, I'm not my trousers. So when you become aware of yourself as a spirit, you can free yourself, because I cannot tell you, oh, this is not important. But if you become aware of yourself as a spirit or spiritual entity, then you can let go of things. There is a lot more to this subject, because we know that this body can live 80 years, 90 years. My mother was born in Berlin in 1923, so she's still alive and her body is 97 years old. It's a pretty old body. At some point, the body's kaput. So what is death? What happens after death? What is the spirit doing after it leaves the body? So when you become aware of all these things, you lose attachment, you become more aware. And the point Tom is making is that for many, many years, we do this successfully, and so you don't need to meditate far away in an ashram for many, many years. You don't need to disconnect from life. You can live your life and raise your awareness, and there are techniques that will make you more aware and less attached. Okay, thank you very much.